Mr. Liang Eng Hwa.
Mr. Deputy Speaker, there's this ancient Chinese saying, 大义不过三, or in literal translation, a major pandemic will not last beyond 3 years. Not sure if that was enough empirical or scientific basis, but after 3 years of pandemic, we can finally move on and live with COVID-19 as an endemic disease. Fortunately, since our decisive opening in 2022 and the resumption to normal lives, we have not seen significant stresses in our healthcare system. And by and large, we have moved on with the COVID very much like a normal flu. Singapore and Singaporeans as a whole went through an extraordinary experience adapting and overcoming the harsh onslaught of the pandemic. In all, 2.2 million people fell ill to the disease. Unfortunately, 1,711 succumbed to the disease, and my deepest condolences to the families. On our economy, we went through a roller coaster ride. In 2020, we suffered the worst full-year recession since our independence, where in the second quarter of that year, the economy contracted by a hefty 13.2%. Among the worst-hit sectors were construction, retail trade, F&B, tourism, and the airlines. Total employment shrank sharply in 2020, while many self-employed were left with no incomes. The nation came to an almost standstill during the 2 months of circuit breaker. I still remember feeling eerie, seeing the streets so empty. Even in this very chamber, extraordinary things happen too. We have to sit wide apart, using up the gallery spaces up there, wearing masks, wiping the mics and rostrum after each speeches, and conducting self-ART tests. We even have 5 budgets in a year, drawn on an unprecedented amount of 37 billion from our reserves. So it's no exaggeration to say that the experiences and images of the last 3 years of our life will be in our living memory forever. Very much like how our earlier generations remember other life-changing events such as the Japanese occupation and the Singapore separations from Malaysia. In fact, we now use the pandemic as a time reference, referring to life before COVID and life after COVID. Before COVID as in BC. So recently in my workplace, we had a workshop with many of my colleagues. And as part of the pre-workshop warm-up teaser, the workshop moderator asked the participants to share what they were most grateful for in the last 3 years. And I'm most heartened that many participants shared that they were most grateful for being a Singaporean during the last 3 years. They felt safe, shielded, and are assured that we are well-resourced, both financially and in terms of capabilities to cope with the crisis. Many knew that there are no perfect way to manage such a formidable crisis of this magnitude and scale, yet appreciated the balanced approach that we took to manage the pandemic. So it is in this context that I like what I read in the white paper on Singapore's response to the COVID-19 pandemic. The paper detailed areas that we have done well, but also, crucially, self-evaluated the areas that we could have done better. There was no glossing over of shortcomings, and almost every area where we can take issue with are covered in the paper. DPM Wong's speech, as well as Minister Tan See Leng's speech, have also elaborated some of these shortcomings. This honest and reflective approach is important as we take stock of the whole of government response to the pandemic, reaffirm and reinforce what we have done well, but also initiate necessary follow-up actions to address the learning points to strengthen our response to future pandemic. Our healthcare system withstood the stresses of the crisis well, albeit with considerable strain. Among the key successes were the capabilities that we have built up post-SARS, namely the National Public Health Laboratory, NPHL, and the National Center for Infectious Disease, NCID. Consequently, the NPHL had the ability to develop our very own PCR test kit early in the pandemic, and NCID was able to attend to early serious COVID patients and save lives. Our entire healthcare ecosystem, both public and private, were mobilized into response as an integrated health system to this unprecedented public health crisis. I read in the media that even retired nurses and medical professionals stepped forward to join the frontline healthcare warriors in this battle to save lives. So we also scored well in our nationwide vaccination program, making the right call with the advanced purchases for the most effective vaccines, and thereafter ramping up to high vaccination rate. Another remarkable area that I wanted to highlight is how we, as a small, tiny island, ensure that vital supplies were not disrupted, despite the lockdowns, the border controls, the intense competition for scarce items, and the export restriction by many countries. I can imagine the uphill task our frontline procurement officers face, securing large amounts of sought-after critical items like medical equipment and supplies, test kit, masks, and a whole range of food and daily necessity. It must have required the officers to use whatever conventional or unconventional means to secure this supply, possibly having to deviate from the usual SOP or the IMs in such emergency situations. So the pandemic also exposed several of our vulnerabilities. It was mentioned by DPM Wong as well as Minister Tan, and allow me to also express my views on the two. Firstly, on the migrant workers' dormitories. Among the most severe situations or the high stress point was the outbreak of the migrant workers' dormitory in this pandemic. The white paper called it a crisis within the crisis. Given the communal living arrangements, the dormitory inevitably became a high-risk area in a highly infectious disease outbreak. Fortunately, as what Minister Tan has said, the mobility and the mortality rate has been very low, notwithstanding the scale of the outbreak there. I noted that MOF has since taken significant steps to improve the dormitory's environment with new standards and continuous efforts to de-risk the exposures. But even, like as what Minister Tan said, even with the significant improvements in the living environments of these workers, we ought to still continue to institute more defensive measures, such as having self-segregating features in the event of a disease outbreak, contingency plans for quarantine arrangements, as well as the BCP setup. So the dormitory outbreak also reminded us that there is really a limit as to how much more we can grow our migrant workforce. So we must continue to review and weigh this trade-off of our dependency. So the second area of vulnerability I want to highlight is the mask wearing part. The white paper highlighted the shortage of masks that we have to contend with. Given our domestic constraint, both the labor costs, labor as well as costs, as well as in our shift towards more high value-adding advanced manufacturing, so producing medical masks domestically may not be economically viable. It is difficult to compete with countries with much lower cost structure. Our domestic demand for masks under a non-pandemic environment is not high enough to achieve the scale efficiency for productions to be viable. Hence, our medical masks are almost dependent on imports. In an ironic way, thanks to the transboundary haze situation that we have faced years ago, the government does stockpile a significant quantity of masks, which help us meet the initial wave of demand when the outbreak happened. But the stockpile quantity is never able to meet the sorts of daily consumption demand needed for an entire population in a long-drawn pandemic. We scrambled to assemble our own mask producing capabilities so that we can produce some of our mask needs locally. So credit goes to MTI, ESG, and the relevant agencies for getting the mask producing factory up in double quick time, just so that we have some additional backup supplies. So in an airborne infectious disease outbreak, masking up can be our first line of defense. As part of a key measure to prepare for future pandemic, we have to designate medical masks as a critical supply item that requires some local production capabilities. However, for the production to be viable, it will require some domestic anchor orders or offtake from the government so that there is a base level production volume to work with. Very much like how PUB undertook the liability to buy certain quantity of desalinated water from water production companies, even though it costs more than treated water. So in this regard, can I suggest two related supportive initiatives? Firstly, continue to encourage Singaporeans to adopt mask-wearing habit, especially when they are unwell, or in healthcare setting, or in highly crowded areas such as public transport or in crowded lifts. This will not only create some local demand for masks, but also help reduce the spread of other airborne diseases such as flu, cold, cough, and other influenza. Studies indicated that there was a sharp decline in flu cases during the pandemic, which could be attributed in part to mask wearing. And just last week, Straits Times reported that doctors saw a rise of as much as 30% increase in flu cases in the last few months as we unwind almost all our COVID measures. If less of our populations were infected with flu and cold, we could free up demand for primary care clinics like polyclinic for other patients, and there will be more healthy people around, which in turn leads to overall savings on healthcare costs for the populations. Secondly, to encourage the population to wear masks, I suggest that the government and perhaps the Mask Foundation consider to continue the practice of distributing masks to every Singaporean household each year as a way to encourage wearing of masks as a responsible social habit, especially if we are unwell. And this could be part of a healthier SG movement too. So one area that I felt that we have also done well, but was not quite well elaborated in the white paper, is the tremendous contribution by the grassroots community volunteers. The grassroots volunteers rose to the occasion in various pandemic operations in the community. For example, just in Bukit Panjang, we distributed masks and hand sanitizers to more than 50,000 residents, delivered more than 4,000 care packs, groceries and social assistance to residents affected by COVID, installed 5,585 bottles of hand sanitizers at lifts, supported the distribution of more than 4,000 Trace Together tokens. Our volunteers also outreached to 12,566 seniors to urge them to go for their rounds of vaccinations. I'm sure members in each of our constituencies have done similar things. This and the many other areas are where our grassroots volunteers have selflessly stepped up in this crisis in carrying out some of these duties at risk of being infected themselves. They make a big difference in the overall health outcomes, providing the last mile support and care at the neighborhood level, and in particular, taking care of those that are vulnerable. So in conclusion, I would like to point out two underpinning factors that enable our ability to achieve the outcomes that we did as listed in the white paper. Firstly is our financial strength. There's this Chinese saying, 钱不是万能，但没钱却是万万不能. Money is not everything, but not having the financial means is inconceivable. When the pandemic landed upon us, the government initially drawn on our current budget surpluses to fund the urgent expenditures in public health defenses and the various support measures for businesses and households. Thereafter, we had to draw on the reserve as the total bill snowballed to $72.3 billion in FY 2020 and 2021. Given the severity and the magnitude of the crisis, I have expected the government to do more to support and assist, but I must admit that the massiveness and the decisiveness in the series of fiscal interventions were more than I expected. It once again demonstrated that the government may well be cautious and prudent in managing its finances during peacetime, but when hit with a severe crisis, the government will not hesitate to use our fiscal firepower in an impactful way to protect lives and livelihoods. In essence, in 2020, is the government spending that prop up the entire economy. So during a severe economic downturn, the foremost concerns often about whether our is about whether our economic capabilities will be permanently impacted, as businesses will run into cash flow problems and some will have to wind down. So the jobs credit, the COVID-19 temporary measures, and the various financing support make a big difference to help our businesses stay afloat and safeguarded our capabilities. When air traffic dropped to almost zero for a prolonged period of time, our national carrier SIA posted full year financial losses in 2020. Fortunately, the company was able to raise massive cash from their rights issue, with its major shareholder, Temasek, pledging to exercise all its rights to buy the shares. And I'm glad that we have shareholders that saw the strong fundamentals and long-term values of SIA, and as well as its business growth opportunities beyond the pandemic. Secondly, given the enormous scale of this global crisis and the fluidity of the situation with the known unknowns and the unknown unknowns, the government has steered the nation well through this crisis. We have kept Singaporeans safe, safeguarded the economy, and taken care of the overall well-being of Singaporeans. In the early stages of the pandemic, the Prime Minister addressed the nation at each turning point of the pandemic updating Singaporeans on where we are and what may lie ahead. The NPF also regularly updated Singaporeans on the latest developments in an open and transparent manner. So I agree with the white paper's conclusion that there has been high quality of governance throughout the crisis. The Prime Minister and the Cabinet has not only steered the nation into safe harbor during the pandemic, but have also set our sights beyond the pandemic with moves and strategies for the country to emerge stronger. In particular, the 4G leadership led by DPM Wong has shown its mettle in leading Singapore through this crisis of the generation. Not that we want it that way, the crisis came at a time as if to test the leadership strength of the 4G team. It's like the baptism of fire. But I believe the DPM Wong and the 4G team has proven their leadership ability, the tenacity, the decisiveness, and courage to take difficult decisions in overcoming the crisis, as well as doing what is right and what is in the long-term good for the country. And more importantly, the 4G team has demonstrated that the well-being of Singaporeans is foremost in their minds and hearts. So I'm heartened and assured that the future of Singapore is in good hands, and together with the fortitude and unity of Singaporeans, we can continue to scale new heights and overcome whatever challenges that may come our way. So with that, I wholeheartedly support the motion. Thank you.